obviously not a good thing. Basically, it's an abnormal growth in tissue. It can be mild or infectious, and other systemic diseases can also lead to restrictive cardiomyopathy. Some more symptoms now. They can occur at any age, but like I said, it usually tends to affect older adults. There's shortness of breath, fatigue, swelling of legs and feet, weight gain, fatigue, inability to exercise. These, as you can see, these are all very general symptoms, and that's part of what makes restrictive cardiomyopathy so hard to diagnose, is because that these symptoms can be associated with so many other diseases that you really can't say if someone walks in to the office and you have these symptoms, you're not going to be automatically say, oh, that's restrictive cardiomyopathy. These are very general. There are some more symptoms: nausea, bloating, and poor appetite. And this can be credited to fluid retention, which is an excessive fluid buildup in your in your circulatory system and in your body tissues or cavities in your body. Palpitations, which are fluttering in the chest due to abnormal heart rhythms. We were seeing a test on that earlier, and so did Kevin. Arrhythmia is a really good example. Arrhythmia is basically an abnormal heartbeat. There's also fainting and chest pain. Fainting is caused by arrhythmia, and also abnormal response to blood vessels during exercise, and also there could be no cause for arrhythmia or why you're fainting. Chest pain is pretty self-explanatory. The disease does affect your heart, so you're definitely going to feel some sort of discomfort in the chest area. Okay, this is part of the gloomy part of the presentation. Just like the other two mentioned, this one is not curable. You're going to have to live with it the rest of your life, but that usually doesn't last more than 5 years. I mean, I know it sucks, but treatment for restrictive cardiomyopathy is very difficult. It focuses on relieving the symptoms of heart failure rather than actually curing it. So the what you're aiming for is not actually curing it; you're just trying to relieve symptoms and slow the progression down. The doctors recommend lifestyle changes. And usually these consist of quit smoking, eat low sodium diets, getting some exercise. Don't do anything stupid. Don't take drugs. Eliminate or minimize, like I said, alcohol. And it depends on the person and also the severity of your disease. Obviously, someone who's further along wouldn't want to exercise too much because that may cause it to get worse rather than you getting better. It all depends. And in some cases, if the condition is really bad, of restrictive cardiomyopathy, they will consider a cardiac transplant or a heart transplant. Some medications, fun stuff here. They're also, like I said before, they're here to prevent further complications, to treat symptoms. So to manage the heart failure, some patients may improve by taking a beta blocker, which these two already mentioned, and an angiotensin converting enzyme, which I'm just going to call an ACE inhibitor, so I don't embarrass myself by not pronouncing everything right. Beta blockers are drugs that block non-epinephrine and epinephrine, which is just known as adrenaline, from binding to beta receptors or your nerves. By blocking adrenaline, beta blockers reduce heart rate, reduce blood pressure by dilating blood vessels. And here's what I would think of: like if you think of blood vessels, think of pressure and volume as inverses. So obviously, if you have a small volume and you have a large amount of blood going in there, the pressure is going to be higher. But what beta blockers do are they expand the blood vessels, and the blood can now rush through easier, so the volume is increased, so pressure is also decreased. So this is how they help decrease blood pressure, beta blockers. Also, they can constrict airway passages by stimulating muscles that are used for constricting airways or air passages. They have been found to prevent further heart attacks and preventing death after heart attacks, so they're very useful. And I'm more of a visual person, so I like to see things, and this is just basically what I just said, summarized in 3 pictures. Beta blockers enter the bloodstream through the gastrointestinal tract, and then the receptors are onto the heart cells, and they're preventing, this is our kind of epinephrine and norepinephrine. And basically what this does, it keeps the heart rate normal, and fight or flight reactions don't occur due to the fact that there's not any epinephrine. Also, I did mention ACE inhibitors, and I want to touch on that. Before I do that, I want to talk about angiotensin II. That's a very potent chemical that surrounding blood vessels and contract. So remember what I just said? If it's a smaller volume, contract, the blood pressure is going to be increased. So it causes high blood pressure. ACE inhibitors are medications that slow or inhibit the activity of the enzyme ACE. ACE is just angiotensin converting enzyme. It decreases the production of angiotensin II, which helps to control blood pressure and also treats heart failure. If the symptoms occur, digoxin, Kevin mentioned this, and diuretics may help treat high blood pressure, and digoxin are just increasing the strength and vigor of your heart contractions. So these will also be used. And if